Hi, I'm an occupational therapy student and this is my story. I'm a second year occupational therapy student. I identify as non-binary and my pronouns are he/they. I live with a condition called ulcerative colitis, which is a form of inflammatory bowel disease, also known as IBD. My condition is currently in remission. Because of this, I have fluctuating fatigue levels. This affects my energy and my focus in my day-to-day life. Because my energy levels fluctuate, this can mean getting up in the morning on one day can be much more difficult than the day before or the day after. This can also make it more difficult to engage and perform well with tasks I need to complete throughout the day. I sometimes have flare-ups of my condition. This is usually in periods of high stress or near my next treatment. They can cause severe pain in my lower abdomen and frequently and urgently needing to use the toilet. When I am having a flare-up, it isn't always practical for me to leave the house in case I urgently need to use the toilet and can't get there in time. When I have to stay in during these periods, I often miss out on what I need to do on that day. Despite facing many challenges, I have had some positive experiences on placement. My practice educators allowed me to work on a project at home alongside my study leave. This meant that I didn't have to travel a long journey there and back 5 times a week. This accommodation made placement a lot more manageable for me. If I could tell my employers and colleagues something about supporting people living with disabilities and long-term health conditions, I would ask them to remember that many people's conditions fluctuate and be aware that people's levels of functioning change depending on the day and their symptoms.